One of the greatest advantages of the ambulatory care was for my mental health. It normalises your life for a part of your life, because you're having this really intense, invasive treatment, so you need to have a little beacon of light to hold on to, and the ambulatory care does that for you.
In ambulatory care, we're very fortunate to be able to provide patients who live outside of the qualifying 1 hour radius to the hospital during treatment the option to stay on site in on-site accommodation. That will just allow you to be on site and much closer to the hospital, negate the need for travelling in and out each day if you live particularly far away, which can be hugely beneficial for many people and still enable them to continue on an ambulatory pathway. The flats are communal in the kitchen and the lounge area, so you may find that if you are staying in the flat you may be congregating with other patients at various stages of their treatment and on different pathways, but you would have your own bedroom which has your own ensuite bathroom.
I did meet other people in the flat, in the communal space, at meal times, breakfast and things like that. You can have visitors. If you want to have a more private discussion, I suppose, the flat is the ideal sort of situation. All you have to do is just follow instructions, turn up at the allotted time, have your treatment, and then go back to your room, to the flat, and do what you want to do. Read, go out, have a meal.
So the ambulatory flats are furnished to a high standard. They have 4 ensuite bedrooms that all have their own TVs in. The process for registering for the network in the flat is guided as an information leaflet which is cited in the ambulatory flat and can be utilised on check-in. In the kitchen there's all the modern appliances that you would need to be able to stay on site in the accommodation and maintain making your own food.
So within the flat there is some food in the cupboards for you, so things like tins of soup, soft puddings that are kept in the fridges. There are nutritional supplements there as well, but there are also meal vouchers available for you, so if you are coming in you're able to at least get 1 hot meal a day from the hospital restaurant.
The facilities in the kitchen were such that, you know, there was a nice oven and a hob, microwave, a coffee maker, kettle, so you could make yourself if you wanted to, you could make yourself a nice Sunday lunch. You know, the facilities were there, and if you'd got the skills to do it.
We make sure that people have access to their own mobile phone. Currently in the on-site accommodation there is no landline communication, so we ask that all patients that will be staying in the flats do have access to a mobile phone. We have the same pathway for out-of-hours monitoring that you would have if you were at home in your own home. So this would be the triage process for symptom advice and monitoring, and if they felt that you needed to come into the hospital, that arrangements would be made for you to come over to the hospital. If you're able to come over yourself, that would be agreed with you. If at that point something were happening that you weren't able to come over, then arrangements to get you over would be made.
It was a good place to base yourself, because I was far enough away to be independent, but close enough that if I had a problem I could just walk back to the triage or ambulatory care and I would be sorted out. I felt safe, but also independent at the same time.